Guys, welcome back to Medical Coding with Blue. Today's episode is all about the medical coding certifications explained. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So I'm going to be talking about the 4 main medical coding certifications that employers look for. There are 6 in all, though, that they look for in health information if you're working in the health information field. So meaning that you're in medical records or, you're in leadership and that kind of thing. But the 4 that I'm talking about today are specifically geared towards coding, okay? Those are the coding side of the house. And I will say this also about the other 2. The other 2 are the degree designations. When you have gone through an official CAHIM program, right? Because if you go through a college program and you get your degree in health information technology, that's the associate's degree, you're eligible, obviously, if you go through a CAHIM approved program, to sit for the RHIT, Registered Health Information Technician. If you go through a health information management program that is approved through CAHIM, then you can sit for the RHIA, the Registered Health Information Administrator. These 2 credentials, though, these are designed for leadership. They are not specifically designed for coding. They are designed for leadership. There is a difference, because if you look at the syllabus of any of these programs, you'll see that the bulk of these programs are about ethics and statistics and leadership, courses and things like that. So those are what those degrees are really covering. The RHIT does cover some coding, and so does the RHIA, the program. It does cover coding because, you have to know, right? You have to understand who it is that you're leading anyway, right? But that's not the bulk of what they do, because they are supposed to be in leadership. So that is what I will say about that. If you have either the RHIA or the RHIT, sometimes employers will ask you to get a medical coding certification. For those of you that didn't hear me the first time, sometimes employers will say that you need one of these 4 medical coding certifications in conjunction with your RHIA or your RHIT if you are working in a coding position. Now, I'm saying it very clearly because every time I talk about this, every time, there's always got to be some smart mouth. Oh, well, no, no. You hear me right, okay? When it comes to the RHIA, the RHIT, these are for our leaders. If you want to be a lead medical coder, if you want to be a supervisor, if you want to run a department, that's what those credentials are designed for, okay? Auditors, right? RHIT, they're really the hands-on ones with the coding side, all right? But RHIAs, that's the director, that's the one that's running the ship, okay? Not to say RHIT can't do that, because there's plenty of RHITs out there that do that as well. So that's what those credentials are designed for, okay? If they want you to get a medical coding certification in conjunction with, right? These are the 4 that employers are looking for. The CCS is the gold standard of medical coding credentials, because it says you have mastered inpatient coding and outpatient coding. And this is a certified coding specialist. There is the CCA, the certified coding associate, that says you have entry-level knowledge of inpatient coding and outpatient coding. And then there's the CCSP, the certified coding specialist, physician-based, which is all outpatient coding. There is no inpatient coding, like ICD-10 PCS covered on this exam at all. These 3 credentials are with the American Health Information Management Association. Now, there is the CPC, okay? It is outpatient credential. If you have no experience beforehand, you will have an apprentice designation for the first 2 years. There's ways of accelerating it, because the CPC is with the American Academy of Professional Coders. They have said, okay, well, if you go through an approved program with us and you complete Practicode, we can remove the apprentice status in less than 2 years' time, because you've gone through all of this. And Practicode, I will say, is it's an educational product. And according to AAPC, it is what they consider what a new coder would do in their first year. This is not an internship. This is not work experience. No, you cannot put this down as work experience on your resume because employers know what Practicode is. It is just an educational product. It is just AAPC's way of saying, okay, well, if you have a 2-year time commitment for this apprentice status on the CPC, Certified Professional Coder, you can accelerate it 1 year by completing this, because not everybody goes through an AAPC program. Some of them study on their own and then they get the CPC and they have the CPCA and they want to accelerate, 1 year. So they only have to work the first year and, they're working their Practicode at the same time. Well, then they can get their apprentice status removed within the first year. So that's the reason that they do that, okay? But it's just what AAPC would consider what they would do in their first year. It is not work experience, okay? So I'm just saying. So employers are looking for any one of these 4. If I did not say a credential that you are thinking of sitting for, or it is free because it comes with your program, I'm not talking about those. And I will not mention those, and I will not respond to anything about those certificates, okay? I will not. But employers are looking for these 4. CCS, CCA, CCSP, or CPC. Now, what did they do? What do these credentials do? Well, the CCA and the CCS both cover inpatient coding and outpatient coding. This means that the person can code for physician-based coding, and they can also code for facility-based coding. There's a difference, okay? Physician-based coding, that is all your CPT procedures, right? Evaluation and management and, your CPT procedures, all those in there. That's all physician-based coding, right? We need to make sure that the physician's getting paid, right? And there's technical ones in there as well, but that's another episode for another time. And then there's ICD-10 PCS, which is all of your inpatient procedure codes. This makes sure that the facility gets paid, that the facility is getting their money for their bandages and for using their hospital and their beds and the nursing staff and all the technician staff and all that kind of good stuff, all of the supplies to take care of the patient and that kind of thing, and feeding them. And it's all with those ICD-10 PCS. This is making sure that the facility is getting paid, okay? So it's 2 different trains of thought because there's 2 different things going on here, okay? 2 different rule sets there's one for CPT and then there's one for ICD-10 PCS. So there's different rules for these code sets. The code sets do not look the same at all either, okay? CPT, these codes are already put together. You can add modifiers to them. There's evaluation and management included in these CPT codes. With ICD-10 PCS, you are given a choice because there's 7 characters, right? Some codes, very few are already built. They already have their full 7 characters. But a lot of them, you're going to have to know the reason why, like the approach and what was it for, and what were they doing, what was the purpose of this procedure. So that way you can select the appropriate characters, right? Because it's alphanumeric, right? These codes are alphanumeric, and you're the one who's selecting these based on the table and then based on the choices of the code, right? So it's going to be different. And if you miss, and it's 7 characters, but if you miss one of these characters, the whole code is wrong, okay? So you have to be really good with that. With the inpatient side, there's also DRG, MSDRG, okay, for our Medicare patients. And knowing, which group does that patient fall in. And knowing about present on admission, that's also something that you have to understand when you're doing that inpatient coding, because knowing the correct identifiers for present on admission, if a condition is present on admission, if it's not, it could affect the payment for the facility, because the insurance company will not pay for a patient who, let's just say, for instance, they came in through the ER and they were admitted because they have a fractured wrist and they need to undergo surgery. So they say, hey, we're going to go ahead and admit this patient because this is a gnarly fractured wrist, right? Well, meanwhile, while the patient's staying in the hospital, okay, so that's present on admission, right, that fractured wrist. But when the patient's staying in the hospital, guess what happens? Patient falls out of bed and breaks their hip. Well, they didn't come in with a broken hip. that broken hip happened when they were in the hospital. So guess what? The coder has to identify, was this present on admission? And they have to say no. Well, guess what? When the insurance sees that, the insurance is going to say, well, we're not going to pay for this broken hip. You broke it, you fix it. So now the hospital's out money because they weren't able to keep their patient safe. Accidents happen, but they weren't able to keep their patient safe and the patient broke their hip. Insurance not going to be at fault to pay that, okay? They will pay for the wrist, but they won't pay for the broken hip because that's on the facility, okay? So it's a whole thing, okay? It is a whole thing. So if you take the CCS or the CCA, you will be able, and you pass it obviously, you will be able to code anywhere. You can code for hospitals, you can code for doctor's offices, you can code for clinics, freestanding clinics, you can code anywhere because this says that you have the knowledge. If you take the CCA says you have entry level. It's a shorter exam, it's a 2-hour exam, but that 2-hour exam packs a punch. There's a lot of things that are covered on that exam, okay? And that exam is not easy. And I had it for 13 years. And I had it for 13 years because I'm very stubborn and I don't like people trash talking and saying things that they clearly do not understand. And so I wanted to change hearts and minds, and I did that with my CCA, okay? But I have since taken my CCSP and passed it, and I've since taken my CCS and passed it. So I currently hold the CCSP and the CCS. The reason that I carry them both is because I got the CCSP first. If I had have just got the CCS first, then I would only have the CCS. But because I had the CCSP first, I went ahead and kept it. It's not financially draining to me to keep them both because I get continuing education units from my facility, so I don't have to worry about that. It doesn't cost me much to maintain them both, so I'm okay with it. But I do always say that if you're brand new, it's your first year in coding, first 2 years in coding actually, that you should only have one. And this makes it a lot easier for you. Even though people will say, well, you need to get a bunch of credentials so that way you can be more marketable. No, what makes you more marketable is your knowledge. That's what makes you more marketable. Not the fact that you have a string of credentials, because I've seen plenty of people who have a string of credentials who are highly incompetent because they don't understand. They know how to take a multiple choice test. That's what they do. So there is a difference, okay? And somebody with one credential can make the same thing as somebody with 3 or 4 or 5 credentials. I'm just saying. So with that said, if you want to code for inpatient coding or outpatient coding, right? Professional fee coding, that is with the CCS or the CCA. Okay, CCS again says that you have mastered it, all right? And it is a very advanced test. It's a 4-hour exam, right? So there's a difference there in the tests in the CCA and the CCS. CCS is longer. It's harder because it's, again, considered the mastery. And you want to make sure that you have a good grasp of the coding. Because even though it is recommended, and people don't understand this word, recommend does not mean required. I say this because I'm the one who gets these messages all the time from people. Well, no, it says I need to have 2 years of experience. No, it doesn't. It says it is recommended that you have 2 years of experience. It is not required that you have 2 years of experience, okay? But with some people, when they go through my independent study video that I have, and they've studied the way that I've said and things like that, they've been able to study on their own, and they've passed the CCS. So it is possible to pass it even without experience. You just have to know how to study, okay? So that I will say there. So if you want to do inpatient coding or outpatient coding, have that variety of places that you could apply, CCS or the CCA is the way to go. Now, the CCSP, the Certified Coding Specialist, physician-based, and the CPC, the Certified Professional Coder, both cover only outpatient coding. So there is nothing about ICD-10 PCS in there, nothing about DRGs or MSDRGs, or present on admission. There is nothing about that on those exams. The CCSP and the CPC cover outpatient coding only. It is about the CPT book. It is about, of course, the diagnosis as well, but You have to know about, like, of course, the reimbursement side of the house, but there's not DRGs and present on admission again on those exams. Okay, that's only for the CCA and the CCS. With the CPC or the CCSP, you have to know about your CPT coding, about your evaluation and management, but don't panic because there's a breakdown of the exams on both the AHIMA website and the AAPC website. So you can go on there, you can check out the candidate hand guide if you're looking on the AHIMA website. You can look at the domains as well on the AHIMA website for the CCSP. If you go with the CPC, you can check all that information out on the AAPC website. And it's going to tell you what the breakdown is, okay? And so for AHIMA, it'll say, well, 33% of them is evaluation and management, right? When it's breaking down, like, I think that's what it was the last time I looked at it. 33% of the test is going to be about evaluation and management. So, not evaluation and management, it's 33% is the emergency department. So when I was thinking of the the case studies in the back. Okay, that's what I was thinking of. But it'll break it down for you, right? Your coding knowledge and skill is going to be the bulk of those tests, but that could be a mix too of things, right? And then with AAPC, I do believe that they do tell you how many questions specifically are evaluation and management. But guys, that's not the whole test. So it's not a reason to panic, okay, is what I'm trying to get at, okay? Don't panic. If you say, well, Blue, I'm not really confident with evaluation and management, that's like a staple that a lot of people will say. And oftentimes, instead of actually studying evaluation and management, they'll hear somebody else say, oh, how hard it is. It is actually not very hard. It is not very hard. When you actually sit down and work through a workbook, and again, I have the study guide available for evaluation and management specifically. And this study guide, you can order it down below. In the description box, it has all the information. But this study guide that I have for evaluation and management follows the Optum Evaluation and Management Coding Advisor. And in it, it's breaking down all the chapters that you're going to go over, and it's telling you how to study this so that it's going to be able to make more sense, but you're going to have to put in the time to do it, okay? Now, the book does not come with the study guide, okay? It is just a study guide. The study guide is 3 pages, and then you get a complimentary additional page for resources, okay? It's got other resources and notes on there, and it's got the listening instructions, so you can listen to like PDF versions of anything, you know, on your laptop or computer, okay? And I give you the instructions on how to do it. So that's something that is available out there. But evaluation and management is nothing to be afraid of. You know, too many people are afraid of it for no reason at all. It is ridiculous how people are afraid of it because of what you heard somebody else say. Well, it doesn't make any sense. How much time are you spending studying it? That can be all the difference in the world. I'm just saying, okay? And that people being scared of evaluation and management has been going on forever since I started school, because when I went through school, I was going through school at a really good pace. And they were saying to me, okay, Blue, you're doing really well. You're going through at a very good pace. But here is where a lot of people start to slow down. And here's where people actually quit the program. And I'm like, oh my gosh, you know, what is it? And they go, it's evaluation and management. And I'm like, well, why? And they go, because they say it's really hard. And they go, we're just telling you, you're doing really good, but just take your time getting through this one because people have quit just for this. And I'm like, well, I'm not going to quit. I need to get with this. So just give me the books that I need and I'll I'll figure it out. So in the way that they had it set up, it wasn't very comprehensive. The way that they had it set up, it was kind of confusing the way that the course was online. And so I was just like, So what I did was I read the book cover to cover. Now, you could, with the Evaluation and Management Coding Advisor from Optum, you could read it cover to cover. However, that book is set up different from the book that I had. And the book that I had is way old, it's out of date, so don't even ask me about the title of it. But this Optum Evaluation and Management Coding Advisor, I did skip some of those chapters because it's not really like some of the evaluation and management codes that are in there are niche, and so they're not really going to be tested on as much as the other chapters will. Okay, so that's where I kind of made it like targeted for, you know, what it needs to be, because this is 11 weeks, but it's 12 weeks. 11 full weeks of learning it, and then on the 12th week you're going over like the things that we skipped over, or you can go back over the things that you know you needed to review again. And so that's the way that study guide is set up. But yes, and it is not a class, okay, just so we all understand, it is not a class, because somebody was confused and asked me when my next class was for evaluation and management. I don't have classes for evaluation and management, okay? I do have a study hall on my Patreon. Patreon is back with study hall. It's been on hiatus for a while, but if you are a paid member of my Patreon channel, I have to say paid because there's Patreon lets people join for free. I don't understand that, but because I don't post anything for free except for reruns of the show, you know. But on the 18th, I will be live on Zoom. I will be doing a study hall, so you can come and ask your questions. I post the link the day before for the study hall, and I, you know, post it so that way the people that are in my paid membership, it's $15 minimum per month. So it's not bad, you know. So they are invited to be in on it, and you know, that's how we go from there. And you ask your question, and then the next person asks the question. So I answer questions while we're there. So if you have evaluation and management questions, then absolutely bring them in if you are a member of my Patreon channel. So that's something that is available, okay? We need to be proactive when it comes to the things that we need to study and the things that we know that we are falling behind on, and evaluation and management should not be one of them. I'm just saying, as easy it is as it is. It is easy. And don't let anybody tell you otherwise. I'm just saying. So, but if you have the CCSP or you have the CPC, you can code for outpatient coding. It doesn't mean that you can't apply for an inpatient coding job. The reason that I say that is because I work at a hospital, and all of the inpatient coders, the ones that use ICD-10 PCS, all of them have a CPC, except for one. She has a RHIT, but all of them have a CPC. So technically, they've only been tested on outpatient coding, but they were able to get hands-on training with my facility, and that's how they were able to get in on the inpatient side. So it's not impossible if you have a CPC to get in on the inpatient side if you wanted to. However, some facilities will want you to get a certification that says that you have tested proficient on it, like with the CCA or the CCS. And if your hospital accepts the CIC, CIC is a certified inpatient coder, and that is with AAPC. If you already have the CCA or the CCS, you really don't need to get the CIC. I'm just saying, but some people see, oh, I gotta have that too. No, you don't. You are already covered with the CCS or the CCA. I'm just saying. So, but if you are with AAPC and you start off with the CPC and you want to get the CIC because you want to say, I'm proficient in inpatient coding as well, then by all means, go right ahead. But I'm just saying. So you have your options, and especially if you were trained in ICD-10 PCS in your coding program, you can always put that on your resume that you have the ICD-10 PCS knowledge, okay, even though you have a CPC, okay? Same thing if you have a CCSP. If you were trained in ICD-10 PCS and you really like it, but for whatever reason, you just didn't want to sit for the CCA or the CCS and you got the CCSP instead, then by all means, make sure you put that on there, you know, on your resume that you know ICD-10 PCS. And that will put you in the running if you are looking at those inpatient coding jobs. Because if you don't and you leave that off of there, they're going to be like, why is the CCSP applying for inpatient coding if they don't know inpatient coding? You know? So that's just, that's what you can do with these credentials. So to recap, If you have the CCA or the CCS, you can apply anywhere, okay? Because it says that you have inpatient coding and outpatient coding knowledge, okay? If you have the CPC or the CCSP, you can apply for outpatient coding positions. But if you have ICD-10 PCS knowledge, you can also apply for inpatient coding as well. But just be advised that they may ask you to get another credential or change your credential. Just saying, okay? So that's the thing you have to know there. You can still apply at a hospital with the CCSP, okay, or a CPC, because there are outpatient clinics in a hospital. Just because you work at a hospital does not mean that you code for inpatient ICD-10 PCS, okay? Now, they may also say, well, we have inpatient professional fee service, right? Okay, a lot of people call it different things. It's professional fee, okay? When a patient is admitted to the hospital, and let's just say a specialist like a podiatrist comes up to visit that patient, that podiatrist needs to get paid for their work. A diabetic patient gets admitted by the internal medicine team. They see that the patient has a diabetic foot ulcer. They call up podiatry. Podiatry comes up there, visits the patient. That is the initial hospital inpatient stay, right? Those codes, the 99221, 222, 223. Then they have the subsequent, and then they have the discharge day. So that's what the outpatient coders are going to be reporting for the physician. So there is that, all right? So just so we know, you can always do that. You can look in your CPT book to see a little bit more about what I'm talking about. But yes, if you have the CCSP or you have the CPC, you can always code for professional fee, okay? Just saying, the inpatient professional fee service. You can always code for that as well, okay? And you don't have to know ICD-10 PCS for that because everything is reported with CPT codes, okay? I'm just saying, and of course, the diagnosis codes too. So, with that said, your knowledge will be where you take it, okay? And your credentials are only as good as you are challenging yourself. If you have stopped challenging yourself, I want to encourage you today to challenge yourself more as far as expanding your knowledge. You can have one credential and be very proficient, or you can have one credential and be incompetent. And not incompetent saying in a mean way. I'm saying incompetent in the fact that you don't know what you're doing. Plenty of people who have multiple credentials don't know what they're doing either. So it is, if you know that that's the case, if you feel like, hey, I'm not really sure of myself on this one, I'm not really sure of myself on that one, or I get really confused about this, then that's where you need to dive in and focus and work on those things. If it is evaluation and management, try to go with the books out there, okay? You can learn from books. If you want to get my study guide, you can also do that too as well. You can order that. You can go through any of these programs that are out there for evaluation and management, but the only thing that's going to help you learn about evaluation and management is actually you putting in the time to learn evaluation and management. So with that said, I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.